Good evening, everybody from Rotary Club of Silicon Andhra. We sincerely thank Ramesh Hariharanji, past district governor, Andrew Rotterman, sir. Thank you, our assistant governor, and it's a great evening. I know it's extremely hot, but the topic itself is also extremely demanding and hot, and the need of the hour. And thank you, Rovina ji, for coming, today and giving us the time and also your efforts to put the mental health topic to our forum or to our club. And I would want Simji to actually introduce you and talk more about you and take it forward. Thank you, Simji.
Thank you, Priya. Thanks a lot. Thank you, everybody, for joining us. There are surprisingly more number of people going through mental health challenges than what we realize actually. And during the pandemic, these numbers have increased and continues to increase. Some of the challenge is how do we identify when we need help, right? What we are going through. Is it a mental health issue or is it something like your normal sadness or things which we go through in life, right? And who do we reach out to in case we feel that we need help? And how do we recognize when a friend or a family member who needs help, right? See, that is when organizations like NAMI, that is the National Alliance of Mental Illness, comes in. So today we are privileged to have the Executive Director of NAMI Santa Clara, Rovina Nimbalkar, here with us to explain all about NAMI's mission. As for Rovina, before taking over this role at NAMI, Rovina had led diverse nonprofit organizations that worked with vulnerable women, children, and families from different cultural, socioeconomic, and ethnic backgrounds. She is passionate about mental health issues and in finding a solution to that. Thank you for joining us today, Rovina. Please do take over. You can
Thank you so much,
continue.
Sim. Thank you, everyone, and thank you for giving me the opportunity to present today and talk about NAMI. I'm going to be sharing a PowerPoint presentation, and let me just do that. Let me share my screen. Yeah, everyone can see it, right? Okay. So NAMI Santa Clara. Oops, I don't know why I'm at. Oh, okay. So NAMI stands for National Alliance on Mental Illness. We are actually a national organization, the only national organization that does advocacy, support work, resources, and referral for an education for mental health issues. In fact, the NAMI Santa Clara County chapter is 45 years old, and we were we were actually the first one to open up for, and then that's after us, then the national organization had opened up. We celebrated our 45th anniversary last year, so it's our 46th year now. What we want to envision is a world where we can tell individuals and family members with a mental health diagnosis that they are not alone. We provide them with education. We do outreach. We do a lot of advocacy work. We have a warm line. We provide support through support groups and other support through our warm line and education programs too. And what we want to do is help remove the stigma about mental health issues. Now, particularly in our South Asian culture, also a lot of stigma about mental health issue, but also here, people don't like to discuss mental health, and they don't like to be getting diagnosed or even talk about it. So we want to tell everyone that you're not alone, and we are there to support you. And this is just mental health diagnosis or mental illness is just like a disease that you would have, any other disease that you would be diagnosed with. For example, if you get diabetes or a heart issue or cholesterol. Similarly, a mental illness is also some kind of a chemical imbalance, and that's something that is treatable, and there's no need to be ashamed of it. So what I'm going to do now is I am going to go over all the different programs that we have at NAMI Santa Clara County. To begin with is the warm line. So a warm line is at one time it's manned by 2 volunteers or staff members. And everyone who answers the calls on this warm line are people with lived experiences. By lived experience, I mean is either they themselves or they have a family member who has a mental health diagnosis. Through this warm line, we provide them information, support, help, resources, referrals, give them guidance, or sometimes even just give them hope. Our warm line hours are Monday through Fridays, 10 a.m. to 6 p.m. And on weekends and on weeknights, we have extended hours where we don't answer the calls, but we check voicemails. You can leave a voicemail, and we can check them every few hours. It's not a crisis line. It's more of a support line where you can discuss issues. Oftentimes people will ask us who are the individuals who are who come to the warm line. Who will call us on the warm line. So it's anyone who's been newly diagnosed, either themselves or their family members, and they don't understand their own diagnosis, or they need access to providers, or even understand information on psychiatrists, or even understand HIPAA laws. We also help in finding a missing person. Oftentimes, a person with a mental health issue might go missing because they might not want the support of their family member, but the family member is concerned about them. So we help with that by putting it on our website or our social media pages, or just coordinating with the families. We help them find shelters, resources for jail, court issues. And oftentimes it's just giving people hope and just wanting to listen to them, especially during the pandemic. When we, hold on, I think somebody's in the waiting room, so I'm just, the message just popped up. So especially during the pandemic, where when we were kind of answering a lot of calls, not only related to the mental health issues, but also how the pandemic has been impacting individuals and families. And so we noticed that the number of calls on our warm line had increased, and so is the length and the intensity of the calls had increased as well. Oops, I think now my computer is stuck.
We can see your slides, Rovina.
Yeah, it's not moving. It's not going to the next one.
I think you need to click once on the presentation, then it will move.
Okay.
Just click once on the presentation.
Yeah, got it. Thanks. Okay, so this is our warm line card. So just in case if you do want to take down the number of a warm line, this is the number. You can take a picture of this. And again, like I think I already mentioned this, we are not an emergency crisis line. If there is an emergency, you do call 911. And for a situation where there is mental health situation, you can always ask for a CIT officer. That's a crisis intervention team. So apart from the warm line, we have educational programs. We have educational programs ranging from that we provide to individuals, to family members, to even providers who actually do case management, or to people with mental health diagnosis, or nurses, or even therapists. So for individuals, the program is called peer-to-peer. This is for people who have themselves been diagnosed with a mental health condition. And this is a class. It lasts about 9 weeks and 2 hours each session, and it really helps you manage your skills and tools that you can learn for your recovery process, as well as give you the communication skills, or even understand your diagnosis and meet other people who might have similar diagnosis and talk to them about their recovery as well. Then we have another program for families. This is for parents and caregivers of somebody else, or your loved one who had a mental health diagnosis. And this is 8 weeks long. And again, this will give you, again, the communication skills, understanding the diagnosis, and a support system as well. Like there'll be other family members who will be in a similar situation like you that you can speak with, because oftentimes if your child or your loved one or your partner, whoever it is, has a mental health diagnosis, you probably don't want to talk to other people who you think might not understand the situation. So here it gives you an opportunity to meet other folks who might be in a similar situation like you. And NAMI Basics is just like NAMI Family to Family, but it's just for parents and caregivers of school-age children up to 22 years of age. All these programs are free of cost. Everything that NAMI we do is free of cost, and everything is remote right now over Zoom. So you can find the details of our classes on our website, or also even call our warm line. And then the provider education classes for anyone who's working with people with a mental health diagnosis. So emergency workers and police, the police department, psychiatrists, therapists, case managers. And this I think this I've taken this course as well, and it really gives you good information about people who are actually have a diagnosis, and builds that empathy for them as well. Because if you go to school as a therapist, or if you go to school as a psychiatrist, I think you learn a lot of theories and you learn about the diagnosis, but you start with having somebody else come in and speak about their journey, their recovery, their struggles. I think that really helps in building empathy, and that's what we also do. A part of the course is also that. And then NAMI Homefront is basically for loved ones over 18 years of age of veterans or active service members who are living with a mental health condition. The NAMI Homefront is actually an on-demand course, so you can actually find it on our website. It's managed by the NAMI National Office. All other programs is managed by us at NAMI Santa Clara County. And then we have support groups. So we have support groups for individuals, we have support groups of families, and all these support groups are listed on our website, which is www.namisantaclara.org. And or you can even call our warm line, and everything is on Zoom right now, so you can go in. We don't ask for any of the information. You can come and go as needed, and it's very helpful to for individuals who have a diagnosis to find that support system. Again, like I think I didn't mention this, all our teachers for all the education programs, support group, everyone is trained by NAMI National Office, and everyone who's teaching a course or leading these groups are individuals with lived experiences. And then we do outreach presentation. One presentation that I haven't put in this slide is the kind of presentation I'm doing. I'm doing a very basic NAMI services presentation. But apart from that, we have two different signature programs presentation. By signature program, I mean that all the NAMIs all over the US will have these programs as well if they opt to do the training for. One is Ending the Silence. Here in this program, this is specifically for middle and high school students. So we go into the schools, do a 50-minute presentation to the students, talk about early signs of anxiety and depression, and give them resources, and talks about facts. And we also have a person with a lived experience come and speak about their recovery process. Similar presentations we do for teachers and parents as well. And when we do these presentations in school, like I'm talking about, before COVID hit, we used to also send the students back with a lot of resources so parents can have access to it as well, and they know what was discussed in school today. Usually this presentation takes place during a PE class or science, psychology, or English class. And in the pandemic, it's been really difficult for us to do this because the schools themselves have been doing an online learning system. So we tried to do some presentations, but we also need that schools have access to counselors when we do these presentations. And it was kind of difficult during the pandemic, but now we're hoping that in the fall, now that schools have reopened, and we can start redoing these again. And then there's the NAMI in our own voice. This is a 60 to 90-minute presentation. We have people with lived experience come up to talk about their recovery, and they share their stories, and they can answer questions and just talk about their journey as of what they went through and what their diagnosis looked like. Another program we have is the Community Peer Program, or the Peer Connector Program. This is a very interesting program, actually. So oftentimes, when you have a mental health diagnosis, so for example, let's say, suppose somebody has depression, anxiety, bipolar, they have a diagnosis, and, they can talk to their friends, they can talk to the family, but oftentimes if you yourself don't have that diagnosis, you don't understand what goes on in the mind of a person who has the illness. So what we do is, through this program, is match individuals with a mentor for 4 months who's gone through the recovery process, then goes through training with us, and then we match them with a person who is recently discharged from the psychiatric hospital. So for example, we have one of NAMI staff placed at Stanford Hospital in the psychiatric department, as well as El Camino Hospital in the psychiatric department. And we actually even have grants with them. And when individuals are discharged, if they're okay with it, if they approve of it, then we match with them as a mentor for 4 months, and work with them on different goals and skill building. People can also, individuals can also come through self-referral. So if somebody calls us on our warm line and says, hey, I want to get into the Peer Connector program, so we'll do an intake for them, and then we'll try to match them. So that's possible as well. This program actually has been really popular, and El Camino Hospital has been supporting us for some time now, and they did a study for this program. So far, we've done about at least over 500 matches in the last few years, and they did a study where they saw that through mentoring, it reduces the chances, it reduces rehospitalization for individuals with a mental health diagnosis. So I think this is something that is coming to the notice of a lot of other organizations too. And recently, I think we just got a grant to help train some other organization in a similar program, because I think this is something becoming very beneficial to individuals, and now I think it's getting noticed as well. Oh, again, thing is gone. And then NAMI Walks. NAMI Walks is actually our only the biggest annual fundraiser. In the real world, which is before the COVID hit, it used to be a really fun event where over 1,500 people used to come and participate and walk. We used to have dance performances and food trucks and just a lot of fun. In 2019, we raised about $305,000. And last year during the pandemic, it was all virtual and we didn't know how we we're going to do, but we managed to raise about $220,000. And it's just thanks to our community and all the people who participated and our sponsors. This year, our NAMI Walks is on October 9th. Our goal is to raise about $230,000. 100% of all the funds go towards all the programs that I have mentioned before this. And this year for the NAMI Walks, we have 3 honorary chairs. We have Congressman Ro Khanna. We have Senator Dave Cortese, as well as Dr. Sarah Cody. They are honorary chairs. And our keynote speaker is San Francisco 49ers player Laken Tomlinson. He actually has been a supporter of NAMI Santa Clara County for a few years now, and he's also donated some of his cleats to us in the past that he has used during the games. And this year he's happy to be the keynote speaker, so we're really excited about it. Again, it's on October 9th, and if you're interested, do let me know after the presentation. I'll also leave a link to our NAMI Walks website. So if you want to create a team for Rotary Club, the Telugu community, that'll be great, and you can promote the event for us. So that'll be really nice. Okay, and then faith nets. So oftentimes what happens is that when a family gets diagnosed for a loved one. So for example, if somebody's kid has been diagnosed with a mental health issue, they go to the faith leader to talk about it, and then the faith leader might not necessarily have the resources or know how to address that. So we have a program called FaithNet, and this is actually funded through the Santa Clara County, and through the FaithNet, what we do is we train especially through this grant, we're training faith leaders in all different communities, especially in the immigrant community, about mental health issues, so that when families approach them, they are better equipped on how to address it and direct them in the right direction and give them the right resources. Similarly, through this program, we also do trainings for mental health care providers, because oftentimes people who are diagnosed with a mental health issue, they also lean towards spirituality for their recovery process. And so just to give them some training, the mental health care providers like therapists and psychiatrists, as to spirituality can also play a role in healing. So we give them some training on that as well. So I'm almost towards the end of my presentation, and this is just a summary page about everything that I discussed today about what NAMI does and all our programs, our warm line, the education programs, support groups, the community peer program, our presentations, NAMI walks, and FaithNet. And I'm happy to answer any questions. Right now, I'll stop sharing, and then I can also share the NAMI walks page with you all, so you have more information on that.
Good, Rovina. Thank you. That was a wonderful presentation.
Thank you.
So I will start the questions. I will have first question. So how would we identify somebody is going through this kind of a situation, and when we do call this number, how do they diagnose them? Are there any tests that get done?
Yeah.
Just like for other symptoms, you do blood test or other things.
Yeah.
I mean, how do you test them? How do you know that somebody has this kind of a problem?
Yeah, sure. So usually, so we don't do the test at NAMI, but I've also worked as a therapist in the past. So I used to do a lot of intakes and do the diagnosis. So I can give you that information based on what I did previously. So usually, when you start seeing, okay, if it's for yourself or and your loved one, your child, or whoever it is, you'll start seeing behavioral notices, physiological changes also. You'll start seeing different changes, mood changes. So once you start noticing those, a lot of times it goes undiagnosed for a very long time. But I think it's very important to pay attention to how you're feeling. Now, obviously during the pandemic, now we started doing outdoor stuff, but for a very long time we were all stuck at home. So all of us were feeling anxiety and depression. So that was a very common feeling that all of us felt. But I think it also goes beyond that. Like, we also see physiological changes, mood swings. So there are so many different mental health. I hate to call it illness. That's why I keep replacing illness with mental health issues. But sometimes it's important to just say it illness. There's so many mental illnesses that it's important to go to a professional, so like a therapist or a psychiatrist, who can do an evaluation for you. So they'll do several evaluations. There is blood work also involved, because like I mentioned, there can be physiological changes as well. And once they do an evaluation, they'll try to diagnose what you have, what's going on. And sometimes it can take a longer time to diagnose it, and sometimes it's easier to diagnose. So once the diagnosis is done, and then they decide what your what you would be doing, like what your next steps are, medications, therapy, what it means. But again, one thing I just want to mention is that mental wellness is not only about taking medications and doing therapy. I think it involves so much more. It involves mindfulness. It involves making sure you feel confident about yourself, and you're not ashamed of of what your diagnosis is, because oftentimes people with so many, like it can be bipolar, it can be schizophrenia, it can be so many different mental illnesses, and people don't feel okay, maybe I cannot do this, or they don't feel confident, or we have situations where they might wonder, oh, am I just like with I don't know if you know, but with schizophrenia, people can hallucinate and see things that are not real, and it can really, and even if you're taking medications, you can bring it in control, but sometimes you just wonder, you just keep self-doubting, is this something that I'm seeing, or is it something that's not true, or it's oftentimes, it's very hard for them. um One thing I think I didn't mention, but 95 to 96% of all the people working at NAMI, so we have a staff of about 61 people, 61 to 64 people, are all people with lived experiences. So they have a loved one who has a mental health diagnosis, or they themselves have a mental health diagnosis. And it's so important as NAMI, I think that is our culture, is to promote and empower people who have who have a mental health issue. So we are all so passionate about the work that we do.
Hi, Rovina, I have a question. Thank you. It is like a wonderful presentation. I mean, most of the times, like, people that are going through these emotions, they're in denial mode, right? Like they don't want to admit they have something. So like, if you notice people around you, or, something like you notice like some unusual changes, I mean, not just the immediate family members, but it could be any outside people, right? Like, so how do we approach the situation? Like, I know most of the times, like, they don't want to listen to what we say.
Yeah.
And also they just want to cut off the topic, or like, just move
Yeah.
on. So
Yeah.
how do we deal with those kind of situations, or how do we help them? Like, we know they need help, but they don't want to or get it. So how do
Yeah.
we deal with those situations?
I think communication is key here, right? I think talking about um, acknow- um, acknowledging that, okay, there seems to be that you might be going through something, and it's sometimes kids or our friends don't want to hear it from us or somebody that they know. So I think asking them if you do you want to see a professional, or we all feel these, we all have these feelings, and I understand it's kind of difficult for you. So I think providing support and providing basically telling them that we believe you and we understand there's something going on, but we want to help you, but we don't want to force you on anything. It's very important for us as well, because we want to be able to see you succeed. I think having that conversation is really important. At the end of the day, if it's an adult, then it's up to them whether what they decide, because they have to take the decision for themselves. And as a parent, or as as a family member, or your friend, whoever it is, I think you feel concerned. But I think providing the resources, you can even provide the resources, say, hey, I've looked up these few things, maybe you want to look into that, and take up an appointment or speak with somebody that who could help. Also, you can always, like, if there is somebody, always give them NAMI's warm line number, and we're happy to talk to them as well. And sometimes when they hear it from the third party, and speak with somebody who's been through similar situation, it really helps them, also, and motivates them. Okay, fine, maybe there is an issue here, and I might want to seek help here.
Okay. Yeah, thank you. That's really good.
Yep. Thank you, Rovina. It's the need of the hour. And so my question here is, could you again, share a little bit about the provider course? I just heard a few lines in the presentations that you mentioned that youth can also actually take this course, the provider course, right?
No, so the provider course is for anybody 18 and above.
18 and
So,
above.
and most of all our programs is for 18 and above, except for the Ending the Silence program, where we go to the middle and high school students. But anybody can take the provider course if you're interested. The provider course is specifically for people who are working with individuals who have a mental health diagnosis. So, for example, I said a therapist or a nurse or a psychiatrist, police department, anyone who's working with them. Now, if you are a family member and you have a friend or a child or a partner or a parent who has a mental health diagnosis, then a family to family course is very, very helpful for you. So, and then for individuals, like if you yourself have a diagnosis, then a peer-to-peer is helpful. And all the programs, I think you can call a warm line and they can put you on the wait list. We usually do it every 8 weeks, wherever the programs are. So like example, the peer-to-peer is 8 weeks. And so we do it after every 8 weeks.
That's fantastic. Good to know. I think it is really important for all of us to know where and how we all can reach out to and share these kinds of challenges. And NAMI is the answer. Thank you. Thank you so
Yeah,
much.
thank you. I do see a question here. Is there a NAMI in Dallas? Yes, there is a NAMI in Dallas as well. If you like, pretty much in every a lot of places. So if you wherever you are residing, if you just Google NAMI and the place, you'll be able to find.
I have a question. First of all, I would like to thank you for a very nice presentation and also want to congratulate Rotary Club of Silicon Andhra for bringing on such programs, even outside of the Rotary general meetings. To have such programs, it's wonderful. Thank you so much, President Priya, for bringing on these kinds of programs. I had a question for you, Rovina. Uh, you said you do give training on spiritual aspects, spiritual training to the people who are faith based. Can you just elaborate a little bit on that for me?
Yeah. So it's a twofold program. So currently, it's all funded by our Santa Clara County. They gave us a $500,000 grant to do this particular program. So basically, in a lot of communities, when there is there's a diagnosis. So, for example, if the child has been diagnosed with a mental health issue, they will go to their faith leader to talk about it, because that sometimes going to the doctor might not be the first step, or start seeing the medical professional might not be the first step. And then oftentimes this faith leader might not have the resources or even know how to respond to a family who has been diagnosed. So what we do is we do these trainings for faith leaders. So once a month, all the faith leaders, they come together, and then our FaithNet team does this training for them as to like what mental health diagnosis means, different kinds of diagnosis, what resources are available, how to address them, basically how to respond in a situation like that. And then similarly through this grant, what we also do is just like uh, uh, healthcare, medical healthcare, mental healthcare providers like psychiatrists and therapists. Um, we give them an understanding on the role of spirituality in the healing process or the recovery process, because there's been so much data that people with a mental health diagnosis, they go through a lot of struggles, because sometimes the medication is not an answer to the problem. Medications work, medications don't work, then they have a relapse, then they might have a different diagnosis, they might have several different diagnoses, they lean towards substance abuse. So we've seen that uh, spirituality plays an important role in the recovery process, and so we give them an introduction to what the role of spirituality is in the recovery process. So if I'm a therapist and I have a patient who comes seeking help, who has a mental health diagnosis and keeps talking about spirituality, that way I have that understanding, okay, this patient is using spirituality as a way to recover as well. It's not only through the medications and the therapy and everything else. So I have that understanding too. Not all therapists know that, how much role spirituality also plays. So that's what we do through this program.
Thank you for answering the question. It's very insightful.
Yeah.
So we also have a question in the chat saying that are these same programs available in all of the US?
So all different, it's different. So all the NAMIs have different programs. You'll have to probably go to their website and check. The NAMI Santa Clara County affiliate is one of the largest in the Bay Area. So we pretty much have all the programs, but I don't know about other NAMIs. So you'll just have to check. Some NAMIs are really small, some NAMIs are large. Um, so it just depends on what programs they adapt from the national office.
There's one more question. How are these programs connected through schools?
So the only program that we have for schools is the Ending the Silence program. And through the program, we do presentations to middle and high school students. So that's our gateway to get into the schools and tell them about, the initial signs of depression, anxiety. Oftentimes, middle school and high school is a time when students start seeing signs of, these mental health issues. So we want to be able to prepare them with all the information and resources.
Thank you. And we also have a question from our district assistant governor, Andrew Rotterman. Would you like to ask the question, sir, or should I?
Sure, I can do that.
Thank you.
So, the schools have realized how important mental health is to the success of students. So I know, like, for instance, in my school district, I'm on the school board for Santa Clara Unified. We've added wellness centers in all of our high schools and middle schools. They have counselors, various mental health services available. So the question was, and I think you've already kind of answered it, was, have you had opportunities to work with school districts to supplement or support the efforts that they're already making?
Yeah, and so I think it's been really hard for us to do this in the last 1.5 years because of the pandemic. But before the pandemic, we used to try to go into several schools in Santa Clara County. And my effort has been last few months has been that I want to be able to have this program, Ending the Silence program, a part of the curriculum for all middle and high school students, that the presentation takes place at least once a year for every middle and high school students. That way they have the resources, they understand what their feelings are. At that age, sometimes you just don't understand what you're feeling, right? Like, you're so confused with all the other changes in your body and your mind, and the peer pressure. I think it's very important for them to have access to this information. So that's something that we are working on. And actually, Senator Dave Cortese is a supporter of NAMI Santa Clara County, and our prior senator for Santa Clara County was Senator Jim Bell. He's been a supporter for a very, very long time. And for Senator Dave Cortese, I think this is one of his priorities as well, is to help with mental health resources for students. I just had a meeting with one of his aides last week, and to talk about how I want to be able to make this a part of the curriculum as well. So I'm hoping that it will be done at some point of time. It might take some time, but I'm hoping it'll be done.
Very good, thank you.
Any more questions from anyone, or any thoughts?
Some thoughts from me. Thank you very much, Rovina. This was very, very informative. So I did take a course with NAMI on learning that it was an experience. For the past several years, I've been trying to help some families. I've been talking to about 7 different families at different times who are going through challenges. And it definitely was a challenge. First of all, it is very difficult, like somebody mentioned, for them to accept that they're going through that. And how do the family members accept that, and how the family members will have to react? There's so much involved in that. And NAMI, all these courses, it was an eye-opening for me when I took that course and saw the content covered in that for several weeks. So I think all of us should consider taking some of these courses, where we do realize how much and how important it is to help people go through that, to identify what people are going through. I mean, over a period of time, when we take these courses and learn, we come to know, at least to get some clues from them. And like Rovina mentioned, talking somebody into, I had somebody, one of my ex-colleagues who was going through this. I had to tell her to reach the normal, helpline. I had to say that I do call when I feel depressed, and then and she did find help eventually there. So it's something like we cannot directly tell them what they are going through. At least we are not the professionals enough there, but there is so much we as individuals can do. by getting ourselves educated, thanks to NAMI. And I do have referred a couple people to NAMI too. And I'm really, really amazed at all the work they are doing. Thanks a lot again, Rovina.
Thank you so much. Thank you.
And this is Krishna, by the way. And what is your view about having meditation, yoga, breathing exercise to come over with these mental illnesses?
Yeah, I think it's very helpful. In fact, a lot of times we do encourage people to do mindfulness. I think yoga, meditation is really helps in our mental wellness, and I think there is also a lot of study that's been done. So we completely support that, and we promote it as well. So yeah, sharing NAMI's website as well.
Yeah, so there's one question also coming saying that where can I go and register for the course?
Yeah, so I've just shared our website, which is www.namisantaclara.org. You have to register the course. You'll have to call our warm line number. So if you go to our website, and I think I shared the warm line number as well, I can reshare that page again. And then you can take a picture of it and then call them, and they will put you in the wait list, because it depends on when the next course schedule is. There was another question that I saw. I haven't looked at all the questions, but I think somebody asked me a question about the difference between bipolar and schizophrenia. And I'll give you a very brief explanation on that. Bipolar can have, it's mainly, can have depression and maniac episodes. So by depression, it's like you'll go in the very lows, and then you'll have a maniac episode where you'll go in like completely highs, and will be like your heart, and again, you'll have physiological changes as well. And so it's basically going just like the word bipolar. It's like two behaviors polar apart, or very high or very low. And then for schizophrenia, it's more to do with hallucinations and the depression and other things. So you'll be hallucinating. So it's very hard for us to imagine, who doesn't have schizophrenia, as to how you can hallucinate, but it's real, because they see things and they really believe it. So there might be nothing in front of you, but they might believe that there is like a monster standing there, or something is happening that's not happening in real world. And in such situations, you always tell them that we acknowledge, in the sense like we understand that you are seeing these things, by saying, obviously not saying that, okay, that's not saying that this is true or not true, that way then you're putting them down, but just telling them that we understand that you're seeing these things, and we are there for you, just to support you. So things are like just reaffirming them and giving them that support system. So that I'm just giving you like a very brief overview of what these two diagnoses are.
And also, can you share the details about the October 9th walk? Do we have to go to the website and register?
Yeah. So let me show you quickly. Actually, I have it open in my pages. I have so many different open right now. Sorry.
Sure. So any other thoughts from our Rotary leadership, Sneha, Mala, Garu?
I have a thought here, President
Devendra
Priya.
Garu, please.
Thank you very much, Rovina. It's very impressive and what you're sharing. And one thing I always felt is education and spreading the awareness is very important for mental health. It's been on my mind for a long time, and I'm glad that I attended this session. And we are looking for, personally, I'm also looking for is how do we create the awareness more? How do we keep this going? It shouldn't be a one-day thing or 1 week thing. So it should be a lifelong kind of an effort. But yeah, anything that you can share with us, like October 9th, wonderful. Definitely will try to make part of the walk. But this should be an ongoing effort, and if any way we can help,
Absolutely.
Yeah. Thank
So
you.
for us also, I think we want to continue doing this. We in fact have, for us, we do a lot of advocacy work. Now, the walk is a way for us to do fundraising and advocacy work through everyone. But apart from that, at our end, we have a legislative and advocacy committee. And we basically, go through different legislatures, support it, basically advocate for them, write letters to the politicians. So we do a lot of that. So we keep doing these, we keep taking these efforts at our end, but also we try to, raise our voices and talk about mental health through our social media pages. So, you can find us on the social media pages on NAMI Santa Clara County. And then about the walk on October 9th, it's a virtual walk. So you can register through by going here and, just join it. Or you can join a team or however you want to do it. And it leads you to a Facebook fundraiser, so you can create your own Facebook fundraiser. It's very easy. I think it's very self-explanatory website too, so you can register and maybe create your own group. And it's walk your own way, which means that you can walk with your team in your community or a park, or just do a class together or meet over Zoom. And then we'll also be doing a virtual event. So we'll be doing some virtual entertainment and music, and then speeches from our honorary chairs and our keynote speakers. So yeah. And then I was also going to show the warm line. That's my presentation. Yeah, so I think everyone wanted this number to. Does it show?
No.
Yeah.
It was showing in the first, but then it became black
Yeah.
completely.
So you can just, I think this is better.
Yeah,
You can just
now we
Yeah.
can see.
Can see.
And I'll share the email in the chat box also. So that way, if you have any questions, you can always reach out to me.
I have another question, Rovina. Sorry.
Yeah. Is it okay if I stop sharing this?
Yeah.
Okay.
Just a second. Let me just take a quick.
Yeah.
Yeah. Yeah, sure.
That way I can see all of you. Yeah.
Okay. I have another question.
Yeah.
Is there anything specific for the LGBT community? Because I know mental health issues do affect people. There is no discrimination, everybody, but
yeah. So
in some cases, we do feel that.
Yeah. We don't have any specific programs, but all we do, we do support them as well. So they can always participate in our programs. We do a lot of social media posts. So we always celebrate the June, which is the LGBT awareness month. So yeah, we do have.
Great.
I'm going to share my email.
Thank you. Yeah, we got that. This is such a wonderful session, and thank you to all our club Rotarians and the leadership, Ramesh ji, past district governor, and our assistant governor for District 5170, Andrew Rotman. Thank you so much. And I would like to also extend the vote of thanks to be done by Saroja Mangagaru, our community services co-chair, and Simji, our chair for community services. Thank you for the wonderful session that you all put together.
Thank you. Yeah, thank you, Rovina. It was really glad, we, a lot of people, could attend, and also a lot of questions from everybody. So hopefully, we'll also, raise the awareness and also do the, to participate in the walk and spread the word around.
Yeah.
Yeah. I mean, your presentation and everything was so good, everything you explained.
Thank you.
Yeah, thank you, and also Simji for working with you and getting this presentation, the speech for this event, and also I thank all the Rotarians and the leadership team for giving us this opportunity. Thank you.
Thank you so much. Thank you for having me.
Thank you. I'll just stop recording the session.
Okay.